What's up, gang? Dr. Andrew Fix coming back to you here for another episode on the code. Thank you again so much for tuning in, listening to this podcast. However, you're tuning in, streaming, whatever platform you're on. Really appreciate your time hopping on and joining us here on the code. And today, what I want to talk to you guys about is the importance of why you have to look at things from the big picture and as a whole picture, particularly as it relates to when we are working with clients. I just recently wrapped up a session with a woman, and just to give a brief background, this woman has had multiple knee surgeries. Recently, about a year and a half ago, she had her knee replaced, and she's actually been seeking out physical therapy at another facility. And she had a several month round of care, after which she was discharged from physical therapy because it had been several months, let's call it 4 months after her knee replacement. Meanwhile, she's still continuing to deal with challenges. She's still continuing to deal with knee pain. She doesn't have her full range of motion back. She can't do the activities that she loves to do. And now it's been a year and a half since she's had this surgery. And, she loves to hike. She loves to play pickleball. She loves to, be active. She has a child that she has to physically help move, a child that has some disabilities. And, she needs to be able to rely on her leg, her knee, in order to do those things. Otherwise, that entire burden will fall to her spouse, her husband. And that's not something that she wants, obviously. So, in the spirit of making sure we look at things as a whole picture and not treat isolated issues like they are just isolated issues and treat them in a vacuum, that's what I want to talk about today. So, and I guess let me preface this by saying it is always easier to be the second set of eyes. At least that's my thought process on it. It's always easier to be the second set of eyes looking at an individual or looking at a problem, because you have the ability to get some context. You have the ability to get the story from that person to talk to you about, like, what have they been doing before? What have they been doing up to this point? What things have they tried? What do they feel like has worked? What do they feel like hasn't made a difference or has not moved the needle? So it's easier to be the second set of eyes. So I'm not, bringing this up as, I'm not going to mention the names or anything like that of the other providers that she was working with or the facility. But this is not intended to tear them down in any way. All the providers I know, we're all just doing the best that we can to help clients within the confines of the facilities that we operate. And, no provider goes into healthcare not intending to help their clients out to the best of their abilities. So let's just get that out of the way. Let's talk about this individual's knee. As she explains to me, the trajectory or the course of care that she's been under at the current physical therapy office that she was seeing prior to coming to see us, she told me about a whole bunch of different knee exercises that she was doing. And this is quite common. Someone, comes into the physical therapy practice post-operatively. They just had a procedure done. It's very easy to run them through a variety of exercises, mobility and strengthening exercises for that joint. They just had surgery on that joint. We're trying to help it recover. I've been guilty of this in the past, in a past life. Sometimes we don't do quite as thorough of an evaluation on those people because we're just so focused on the surgery that they just had. Well, in the case like this, a year and a half prior is when she had this procedure done. What I wanted to do upon having the opportunity to work with her is do a much more thorough assessment. We are not just going to look at her knee. And of course, that's what we did. We looked at other things. And what we found was she has a significantly stiffened hip on the same side, that same leg, the left side, compared to the other hip. Her ankle, super stiff on that left side compared to the other side. And of course, that's the side that she's still having knee pain on, her left leg. But what she told me is that nobody has previously looked at her ankle. Nobody's looked at her hip and done hip assessments and hip range of motion tests like we did in the evaluation. And as a result, she hasn't been doing any hip mobility or strengthening exercises, with the exception of some banded sidewalks or something, which is a pretty standard physical therapy related exercise that many people have done. Put a band around your knees or your ankles, step side to side to try and strengthen or build some endurance in your glutes. So so her ankle doesn't move well, her hip doesn't move well, and so weak on that same side. Very locked up, and I like to use the word guarded tissue tension through the hamstring, through the quad, through the adductors on that left side. as far as the kneecap goes, as far as the scar mobility and stuff goes on the front of the knee, all that seems to be moving quite well. Okay. So, anyways, we go through an assessment. We give her 4 exercises to do. All 4 of these are things she's never done before, even though she's been in physical therapy for a while. And of course, we all have different exercises and different things that we like to have people do, different exercises that we really like, things that we think really helps. Um, but what she told me is she's basically just been doing leg extensions, seated leg extensions, and seated leg curls, things where she's trying to strengthen her quad and strengthen her hamstring. And that's basically what she's been doing. Some squats and whatnot, but she's not adding any weight to the squats because there's still some pain in her knee. And that's pretty much been the majority of the extent of her rehab to this point. Now, you might be thinking to yourself, well, those are good exercises. You know, the leg extensions help to strengthen the quad, the leg curls help to strengthen the hamstring, those both attach to the knee. You'd be absolutely correct. But you got to remember, this particular person, she oh, and I didn't even mention in this video, she's also had abdominal surgery in the past as well. So, from a core stability, low back stability standpoint, a lot of low hanging fruit, a lot of room to be had in terms of improving our ability to breathe and brace effectively to stabilize the low back, stabilize the pelvis as we're going through strengthening exercises for the hip, for the knee, as we're picking up, moving things, etc. So, long story short, we cannot look at this person, this individual, because they had a knee surgery, just like we need to rehab their knee. We need to think about how this interacts and how this plays with the entire body. Like, what is the ramification on the entire body? More than likely, the hip weakness, the hip stiffness, the ankle stiffness and weakness, more than likely these things far precede a year and a half having this knee surgery in the first place, because likely they were part of the reason why that knee continued to give her trouble, why that knee continued to, I don't want to use the term wear out, but why the arthritis continued to worsen, because the mechanics were not quite as sound as they could be, because we were lacking mobility, lacking strength and stability at joints above and below the knee. So, of course, the knee is going to get caught in the middle of this hip and this ankle not functioning the way that they should. That's going to put more stress and damage into the knee. That's going to lead to a more arthritic situation. That's, more importantly, that's going to lead to not being able to do the activities and the things that she loves to do. And there you have it. She has a knee replacement. And now, because those other things haven't been addressed that likely led to this in the first place, she's still continuing to have knee pain despite having a replaced joint. Isn't that crazy? So, anyways, we're working together. And many of the issues that many of the symptoms that she's describing there in her knee, to me, sound like things that are coming from external to the joint, things that are coming from outside the knee joint. Things that we would hear people in the clinic say all the time, even if they had not just had a knee pain. You know, she's having some pain down just below her knee on the inside. She's having still some numbness down on the outside. She's having a lot of tension and tightness above the kneecap. But none of the things that she's saying make me think that it is inside the knee joint where the replacement happened. That's what's giving her the problem. I think a lot of these symptoms are coming from outside the knee, impacted by the hip, impacted by the ankle, impacted by the tension and tightness along the front side of her thigh and the weaknesses that are present. And you guys, it's not rocket science, right? If we have pain in a joint, we can't just look at that joint. We need to look above, we need to look below, we need to look at the person's history, we need to think about the way that they're feeding and fueling themselves, the way that they're sleeping and recovering with their body. We need to think about the stress and the other lifestyle factors that are going on for this individual. And we need to think about the exercise and the movement and the actual mechanics, right? We can't just look at that one. We can't just look at the one joint. Otherwise, we're not going to be able to treat this individual to the best of our abilities. So if you've got something that's bothering you, remember, you can't treat issues in a vacuum, because otherwise you're going to have results that are in a vacuum that aren't going to expand to be widespread positive changes. And sometimes you'll have results that last for a little while, but they don't actually last long term because you didn't address the entire picture. You didn't address the entire issue that was present, or multiple issues in a situation like this. So I hope you don't have these things going on, but the truth is many of us do have issues that are bothering us. I've got things, you've got things, your friends and family have things. So just make sure you're looking at things globally and not in an isolated fashion so that you can get through them and back to the activities that you love to do. Okay. I appreciate you guys sticking with me through this entire episode, talking about why we can't treat issues in a vacuum. Otherwise, you'll get results in a vacuum. If you've never left a review on this podcast, now would be an awesome time to go do that. I really appreciate you. Thanks again for tuning in to this episode of The Code, and we'll catch you guys next time. See you later.